Hey, how are you today? Good. Alright, my name is Jada and I'll be a student nurse. Can you verify your name and date of birth for me? Okay, Ms. Smith, so today the doctors have ordered for a urinary catheterization. And basically, it is a urinary catheter, a tube that will go through your urethra and into your bladder. It is placed there to release urine and release some of the pressure that you have. Okay, so I'm just going to uncover you. Can you let me know if you have any allergies, specifically to betadine, iodine, or latex? No? Okay, perfect. Okay, so we're going to begin with some peritoneal care. And the patient is female, so we will place the patient in dorsal recumbent position. And if the patient was a male, he will be placed in the supine position with his feet slightly apart. Okay. Alright, so I'm going to have my soap and water here. We're going to wash the labial. Each labial using only one part of the towel for each side, washing from front to back. Okay, and now that we're done with that, I will begin to set up my supplies. Okay, I'll use this bag for my trash can. Alright, and now starting with my urinary catheter kit, I will begin by removing the flap farthest away from me. Okay. Alright, now I will put on my sterile gloves. And now we will begin to complete the process. Okay, so my field is no longer sterile because the pad touched her leg. Okay, so I will begin by taking the lubricant and placing some there. Alright, getting the iodine solution and pouring it over the cotton balls. Okay, and before we get started, we're just going to make certain that our balloon is properly working. Okay, and our balloon is working. Okay, and I'm just going to place the urinary catheter in the lubricant 2 to 3 inches. And before we begin the insertion, I'm just going to clean her. So I'm going to take one cotton ball on one side, the side that's furthest away from me, and on the other side. Then we're going to use my non-dominant hand and go down the middle. Okay, now we're done with that. Alright, I have lubricated the tube 2 to 3 inches. And now I'll begin insertion. Alright, Ms. Smith, if you could just take a deep breath for me. 1, 2, 3. Okay. And since, of course, she is a female, when I begin to see urine, which is now, I will continue to insert the catheter 2 to 3 more inches. Okay, catheter has been inserted, and now I will hold the catheter here and inflate the balloon. Okay, and without releasing pressure, I will remove. Okay. Alright, and I'm going to check for resistance with the balloon just to make sure that the catheter is stable and within the bladder. Okay, so now I will continue to tape the urinary catheter to her leg, her thigh, and just to make sure that she has some room for movement, I'm going to give her a little slack. Okay, and now I will place the bag on the burial. Okay, and now the doctors have ordered for a specimen. Okay, and since I have just inserted the urinary catheter, I will be able to get the specimen from the bag. Okay, and if the urinary catheter, if the specimen was not retained immediately, then I would have to get it directly from the catheter. All right. I'm just gonna dry her off now. Make sure she's comfortable. Alright, Miss Smith. Alright, the doctors have ordered for the removal of your urinary catheter. Just a little. Push it back into the recumbent position. Okay. Alright, we're going to remove the tape. Deflate the balloon. And first I'm going to make sure that all of the urine is empty out of the bag. Alright. Okay, if you could just take a deep breath for me, Miss Smith. On the count of 3, we're going to remove it. 1, 2, 3. Good job, and everything here will be documented.